Greetings from Lilavati Hospital on the occasion of World Kidney Day. Lilavati Hospital is a tertiary center and I am Dr. L.H. Suratkal, a senior consultant nephrologist. I have been associated with this hospital right from its inception. This is a premier teaching hospital and we train young nephrologists for the board exam. We have a number of young nephrologists who have passed through this institution and are practicing throughout the country. In Lilavati, we have facilities for treating of acute renal patients, chronic kidney disease, transplantation. We have problems of nephrotic syndrome, glomerulonephritis, and the facilities we have are hemodialysis, peritoneal dialysis, transplantation. We do kidney biopsies, we do renal access, vascular access procedures, and these are the procedures that are done in the hospital. But today I'll be talking to you about a scourge of this century, namely diabetes. Now it was projected that by 2025, there will be around 300 million diabetic patients. However, already in 2021, we have 537 million diabetic patients. Out of these, 88 million patients are in Southeast Asia and 77 million patients are in India itself. The projections for India were that we would be having 79 million patients by 2030. However, we have already reached that goal by 2021. So India at present has the dubious distinction of being the diabetes capital of the world. Out of these patients, 5% of patients will already be having diabetic nephropathy at the time of diagnosis of diabetes. This is because half these patients are not aware that they have diabetes. Around 30 to 40% of these patients will then develop diabetic nephropathy by around 10 years. Besides nephropathy, there are other microvascular complications that occur in diabetes, and these are retinopathy, which can lead to blindness. There are other problems like neuropathy. There are microvascular complications that occur, that is mainly in the hearts where you have coronary artery disease, or you may also have cardiomyopathy where the ejection fraction of these patients are very poor. You may have peripheral vascular disease leading to gangrene and which leads to amputations. You may have cerebrovascular disease and this may lead to strokes. The renal manifestation, generally they develop hypertension, and this also leads to progressive proteinuria and a gradual decline of the renal function over a period of time. Hence, all these diabetics should also look out for blood pressure and they should check their eyes and the creatinine and urine for proteins once a year. The best way to prevent diabetes is to keep your body weight under control, live a good lifestyle, do regular exercise and eat in moderation. One should avoid excessive alcohol and avoid smoking. Once you develop diabetes, one should achieve good glycemic control and keep your HbA1c around 6.5 to 7%. One should also keep the blood pressure under good control, which is 140 by 90. Once these complications occur, like nephropathy or cardiac problems, then it is important that you keep your blood pressure under very strict control of around 130 by 80. And for these, the best drugs are ACE inhibitors and ARBs like losartan, telmisartan or ramipril. These are good because they block the renin-angiotensin system and can decrease proteinuria. However, initially the creatinine might rise with these patients, but if it is less than 30%, you may continue these drugs. You also have to monitor for hyperkalemia because these patients can develop hyperkalemia, and you have to adjust the diet of these patients and see that they are not taking any other drugs which can also cause hyperkalemia. Now, besides nephropathy, these patients can also have cardiac problems. We have what is known as Cardiorenal Syndrome, and this means that any dysfunction in one of the organs can cause dysfunction in the other organ. Hence, one has to look out for the dysfunction in the heart also. Drugs like NSAIDs, painkillers should be avoided in these patients. Dyes, one has to be careful because when you evaluate the heart, you would have to use a lot of dyes, so it should not be used discriminately. You also should treat anemia. For the cardiac problems, now there are newer drugs that have been established. These are Sdlt2 inhibitors. Now these drugs not only can control your diabetes, but also help to protect the heart and also to protect the kidneys. These can cause the loss of sugar in the urine. These are drugs like dapagliflozin, canagliflozin, and these are now in vogue for use in these patients. But one has also to be aware of the side effects of these drugs, which of course your nephrologist will take care for you. Once you have reached end-stage renal disease, then you have no options but to go for renal replacement therapy, that is either hemodialysis, peritoneal dialysis, or transplantation. Diabetic patients need these facilities earlier because they have so many comorbidities. Even the vascular access or the peritoneal dialysis access has to be placed earlier in these patients. But we know that all these modalities are quite expensive and they are not without their own problems. Hence, you have to remember the adage that prevention is better than cure. And finally, whatever your problems, there is always a light at the end of the tunnel. And remember, today is the first day of the rest of your life. Thank you.